A 14-year-old patient has nonspecific complaints about pain in his or her legs. The physical examination is unremarkable. Laboratory results are within normal limits, except for a markedly elevated alkaline phosphatase level. The psychiatric mental health nurse practitioner A. interprets the findings as normally occurring during a rapid adolescent growth spurt. B. obtains a rheumatoid profile because elevated alkaline phosphatase is a sign of early rheumatic fever. C. orders a repeat blood test. D. suspects that the patient has acute pancreatitis. The answer is A. interprets the findings as normally occurring during a rapid adolescent growth spurt. Laboratory findings for a patient with an alcohol use disorder indicate increased liver function values and A. a decreased mean corpuscular volume, MCV, and normal triglyceride levels. B. elevated potassium and chloride levels. C. increased MCV and elevated triglyceride levels. D. increased urine and serum creatinine levels. The answer is C. increased MCV and elevated triglyceride levels. A new patient arrives at the office for treatment for depression. The patient reports taking simvastatin, Zocor, and lisinopril, Zestril. When selecting an antidepressant, the psychiatric mental health nurse practitioner eliminates fluoxetine, Prozac, based on the knowledge that the combination can lead to increased plasma levels of the statin, resulting in an increased risk of muscle damage and rhabdomyolysis. The nurse practitioner's reason is that A. both medications are CYP453A4 inhibitors. B. both medications are CYP453A4 substrates. C. One medication is a CYP453A4 substrate and one is a CYP453A4 inducer. D. One medication is a CYP453A4 substrate and one is a CYP453A4 inhibitor. The answer is D. One medication is a CYP453A4 substrate and one is a CYP453A4 inhibitor. During a mental status examination, an 18-year-old patient reports feeling bugs crawling under the skin. The psychiatric mental health nurse practitioner documents this statement as A. a developmental disorder, and suspects cocaine use. B. a hypnagogic hallucination, and suspects schizophrenia. C. a hypnopompic hallucination, and suspects schizophrenia. D. a perceptual disturbance, and suspects the use of cocaine. The answer is D. A perceptual disturbance, and suspects the use of cocaine. The psychiatric mental health nurse practitioner is responsible for initiating quality improvement at a community mental health clinic. The effective strategy for evaluating the clinic's services is to A. analyze the data from epidemiological studies. B. conduct a root cause analysis. C. interview patient families. D. use a survey to elicit patient satisfaction responses. The answer is D. Use a survey to elicit patient satisfaction responses. The psychiatric mental health nurse practitioner evaluates a new adult patient via telemedicine. The patient has questions about a new medication that he or she recently started. The nurse practitioner decides to provide psychoeducation and to A. email drug information and resources. B. encourage the patient to seek information on the internet. C. have a phone conference with a family member. D. refer patient to a local primary care provider. The answer is A. email drug information and resources. any court of law that evaluates the standards of care provided by the psychiatric mental health nurse practitioner. A. Compares the actions to the standard of care provided by a psychiatrist. B. Considers what a reasonably prudent healthcare provider would do. C. Evaluates patient satisfaction data. D. Reviews the nurse practitioner's charts for similar patients. The answer is B. Considers what a reasonably prudent healthcare provider would do. The psychiatric mental health nurse practitioner and a team of local mental health professionals are asked to provide crisis counseling service after a gunman recently took a class hostage at a local elementary school, wounded several students, and then shot himself. In preparing for this assignment, the nurse practitioner recognizes that A. A child's developmental stage will influence his or her response to catastrophic stress. B. A child's lack of an emotional response to a catastrophic event is a predictor of negative long-term consequences. C. It is necessary for the child's guardian to be present. D. The event is more important to the child than whether he or she suffered physical harm. The answer is A. A child's developmental stage will influence his or her response to catastrophic stress. A 32-year-old female patient informs the psychiatric mental health nurse practitioner that she is 3 months pregnant. She has been stable on fluoxetine, Prozac, for the last 2 years. The patient asks whether she may safely continue this medication during her pregnancy. The nurse practitioner responds, A. At this time, Prozac is safe for you to continue during your pregnancy. B. Cognitive behavioral therapy has proven to be successful during pregnancy with no risk to the fetus, so let's discontinue your Prozac. C. Let's review the risks and benefits of continuing or discontinuing Prozac for you and the fetus. D. This medication is unsafe for the fetus, so we'll wean you off this medication during your pregnancy. The answer is C. Let's review the risks and benefits of continuing or discontinuing Prozac for you and the fetus. Established clinical guidelines suggest that suicidality is decreased by treating patients who have borderline personality disorder with A. Eye movement desensitization reprocessing. B. Cognitive behavioral therapy. C. Dialectical behavioral therapy. D. Interpersonal therapy. The answer is C. Dialectical behavioral therapy. A 6-year-old patient with autism spectrum disorder has not responded to 6 months of psychosocial interventions and continues to demonstrate aggressive tendencies toward a younger sibling. The psychiatric mental health nurse practitioner prescribes A. Carbamazepine, Tegretol, 200 mg once a day. B. Haloperidol, Haldol, 2 mg once a day. C. Risperidone, Risperdal, 0.25 mg once a day. D. Venlafaxine ER, Effexor XR, 37.5 mg once a day. The answer is C. Risperidone, Risperdal, 0.25 mg once a day. The psychiatric mental health nurse practitioner working in a crisis stabilization unit evaluates a patient verbalizing suicidal thoughts after being sexually assaulted. Before processing through the traumatic event, the nurse practitioner first attempts to A. Provide an environment of safety. B. Incorporate psychoeducation to address emotional dysregulation. C. Promote cultivation of coping strategies to enhance distress tolerance. D. Provide intense psychotherapy. The answer is A. Provide an environment of safety. The psychiatric mental health nurse practitioner uses a cognitive behavioral approach to help a patient address self-defeating behaviors. After identifying the stressor that causes the inappropriate behavior, the initial strategy is to explore A. Alternative positive responses to the stressor. B. Negative consequences of the responses to the stressor. C. Possible outcomes of alternative responses. D. Rational and irrational beliefs about the stressor. The answer is D. Rational and irrational beliefs about the stressor. A patient who has borderline personality disorder experiences intense anxiety when the psychiatric mental health nurse practitioner goes on vacation. The most appropriate explanation for this reaction is that the patient A. Employs primitive idealization. B. Employs projective identification. C. Has not developed clear ego boundaries. D. Has not developed object constancy. The answer is D. Has not developed object constancy. An initial psychiatric evaluation of a patient reveals a normal mental status and appropriate behavior, despite a parent's reports of disobedience, poor grades, and laziness. To further assess the patient's functioning, the psychiatric mental health nurse practitioner first A. Asks the parent to bring in the patient's educational and medical records. B. Meets with the parent and patient together to explore the discrepant report. C. Asks that the parent complete a child behavioral checklist at home. D. Screens for signs of emotional, physical, sexual, or verbal abuse of the patient. The answer is B. Meets with the parent and patient together to explore the discrepant report. The psychiatric mental health nurse practitioner is employed in a newly created attending role on a psychiatric inpatient unit. To promote an interprofessional environment, the nurse practitioner A. Assigns a role for all staff members in improving patient outcomes. B. Discusses the resistance directly with the physicians. C. Educates staff members on the role of a psychiatric mental health nurse practitioner. D. Works with the nurse manager to organize all levels of nursing staff. The answer is A. Assigns a role for all staff members in improving patient outcomes. The psychiatric mental health nurse practitioner sees a 12-year-old patient who takes lisdexamfetamine, Vyvanse, 50 mg daily for attention deficit hyperactivity disorder. The nurse practitioner observes a tic, which the parents report began after the patient began taking the psychostimulant, and it has been increasing in severity. Both the parents and the school report that the medication is helpful. The nurse practitioner A. Continues the psychostimulant and has the parents and school observe the patient. B. Discontinues the psychostimulant, prescribes guanfacine extended release, Intuniv, and monitors the patient. C. Increases the dose of the psychostimulant and schedules a follow-up appointment in 3 months. D. Prescribes methylphenidate extended release, Vyvanse, on a dose appropriate for the patient's age and monitors the patient. The answer is B. Discontinues the psychostimulant, prescribes guanfacine extended release, Intuniv, and monitors the patient. A patient from India emphasizes a strong feeling that he or she is one with Brahma and connected to life through this being. While developing a treatment plan, the psychiatric mental health nurse practitioner realizes that this patient's spirituality also guides his or her A. Ability to engage in treatment. B. Interpretation of life events. C. Predisposition to illness. D. Response to medication. The answer is B. Interpretation of life events. The psychiatric mental health nurse practitioner is tasked with continually improving the quality of care on an inpatient unit. The nurse practitioner implements A. A chart review analysis. B. A root cause analysis. C. A plan do study act process. D. Failure effect mode analysis. The answer is C. A plan do study act process. To improve treatment and patient outcomes, the psychiatric mental health nurse practitioner utilizes evidence-based practices. An acceptable resource for evidence-based meta-analysis is the A. Cochrane database. B. Medscape database. C. PubMed database. D. WebMD database. The answer is A. Cochrane database. The psychiatric mental health nurse practitioner is concerned about access to care issues in the local community and wants to help develop healthcare policy to help patients access care more effectively. The nurse practitioner knows one of the most effective avenues for developing and advocating for policy is A. Asking the clinic manager to explore options for access. B. Organizing a political protest. C. Working with the local chapter of the Nurses Professional Association. D. Writing letters to the editor of the local newspaper. The answer is C. Working with the local chapter of the Nurses Professional Association. A patient is referred to an outpatient psychiatric clinic for evaluation of depressive episodes after bouts of overeating. Assessment reveals a 5-year history of episodes of uncontrollable overeating precipitated by feelings of tension. This occurs about 2 to 3 times per week and for the past year has been associated with laxative use, self-induced vomiting, and periods of fasting to maintain body weight. The patient reports becoming increasingly depressed and has considered suicide in the past. The treatment plan includes medical evaluation with electrolyte studies and A. Bupropion, Wellbutrin, for depressive symptoms. B. Lisdexamfetamine dimesylate, Vyvanse, for eating disorder. C. Recommendation for psychological and personality testing. D. Referral for cognitive behavioral therapy. The answer is D. Referral for cognitive behavioral therapy. The psychiatric mental health nurse practitioner evaluates a female patient referred with a 3-month history of moderate to severe postpartum depression. The patient has been in therapy for 3 weeks and has not been prescribed medication, despite several interactions with her obstetrician and primary care provider. After researching the healthcare system's organizational factors that contributed to this fragmented care, the nurse practitioner A. Advocates for including mental health content in non-psychiatric graduate specialties. B. Discusses the lack of mental health education. C. Files a complaint with the appropriate regulatory boards regarding the patient's prior care. D. Presents at the local American Congress of Obstetricians and Gynecologists meeting. The answer is A. Advocates for including mental health content in non-psychiatric graduate specialties. The neuroprotective treatment of choice for bipolar disorder is A. Carbamazepine, Tegretol. B. Divalproex sodium, Depakote. C. Lithium, Escalith. D. Risperidone, Risperdal. The answer is C. Lithium, Escalith. A PMHNP understands that neurotransmitter implicated for alcohol addiction are A. Glutamate and dopamine. B. Dopamine and GABA. C. GABA and acetylcholine. D. Serotonin and neuropeptides. The answer is A. Glutamate and dopamine. A 35-year-old depressed patient came in for a follow-up. He said he would like to know more about depression and wonders which neurotransmitter is responsible for it. The two biological amines responsible for depression are A. Serotonin and norepinephrine. B. Norepinephrine and GABA. C. GABA and glutamate. D. Serotonin and GABA. The answer is A. Serotonin and norepinephrine. The PMHNP working in a college setting understand that serotonin synthesis occurs in A. Raphe nucleus. B. Thalamus. C. Nucleus basalis of Maynard. D. Pituitary gland. The answer is A. Raphe nucleus. The PMHNP understand that dopamine synthesis occurs in A. Ventral tegmental area and substantia nigra. B. Raphe nucleus. C. Nucleus basalis of Maynard. D. Nucleus accumbens. The answer is A. Ventral tegmental area and substantia nigra. Which area is norepinephrine synthesis occurs? A. Ventral tegmental area and substantia nigra. B. Raphe nucleus. C. Nucleus basalis of Maynard. D. Nucleus accumbens. E. Locus coeruleus. The answer is E. Locus coeruleus. A 40-year-old female patient on Risperdal asks, "Why are my breasts enlarged and secreting milk when I am not pregnant?" As a PMHNP, you answer this is due to A. D2 blockade in the mesolimbic pathway. B. D2 blockade in the mesocortical pathway. C. D2 blockade in the nigrostriatal pathway. D. D2 blockade in the tuberoinfundibular pathway. The answer is D. D2 blockade in the tuberoinfundibular pathway. Part of the brain involved in anger, fear, and aggression. A. Thalamus. B. Hypothalamus. C. Hippocampus. D. Amygdala. The answer is D. Amygdala. Part of the brain involved in storing short-term memory to long-term memory. A. Thalamus. B. Hypothalamus. C. Hippocampus. D. Amygdala. The answer is C. Hippocampus. PMHNP is treating hyperprolactinemia. Which is the treatment for this condition? A. Bromocriptine, Perlidel, and cabergoline. B. Levodopa-carbidopa. C. Donazepam, Aricept, and rivastigmine, Exelon. D. Norepinephrine and dopamine reuptake inhibitors. The answer is A. Bromocriptine, Perlidel, and cabergoline. A few months after taking risperidone with Haldol, a 40-year-old patient began to experience EPS. As PMHNP, you know this is likely due to blockade in which pathway? A. Temporal artery. B. tuberoinfundibular. C. Raphe nucleus. D. Nigrostriatal. The answer is D. Nigrostriatal. A 10-year-old child with mood disorder, irritable, lack of sleep. What neurotransmitter is responsible? A. Serotonin. B. Glutamate. C. Alpha blocker. D. Acetylcholine. The answer is A. Serotonin. A 34-year-old man is seen in the emergency room with headache, dizziness, and blood pressure of 210/150 millimeters of mercury. He has no medical problems, feels fine, and says that last night he even had a nice meal with wine. Which of the following medications is likely taking? A. Bupropion. B. Lithium. C. Amitriptyline. D. Phenelzyme. The answer is D. Phenelzyme. A 35-year-old woman has been taking medication, the name she doesn't remember, for her mental condition. She complains of excessive thirst and urinating all the time. What is the likely diagnosis? A. Bipolar. B. Major depression. C. Panic disorder. D. Schizophrenia. The answer is A. Bipolar. Parents of child with Tourette syndrome are concerned about tardive dyskinesia. Which med should PMHNP prescribe to reduce the risk? A. Cialis. B. Clonidine. C. Risperidone. D. Haloperidol. The answer is B. Clonidine. A teenager suffers from bulimia nervosa and is depressed. Also suffering from apathy and insomnia. Which of the following medications should be avoided? A. Fluoxetine. B. Trazodone. C. Imipramine. D. Bupropion. The answer is D. Bupropion. What is SAMHSA nonlinear approach to substance abuse? A. Getting off the substances through discipline. B. Teaching them what they were not taught by their mother. C. Recovery is the focus of SAMHSA. D. They are there to collect donations. The answer is C. Recovery is the focus of SAMHSA. A 30-year-old female is taking risperidone and added Reglan recently for bowel regimen. She has shaking when sitting still. NP understands that Reglan will cause A. Increased cardiac arrhythmias. B. Increased renal clearance. C. Increase in EPS like tardive dyskinesia. D. Weight loss. The answer is C. Increase in EPS like tardive dyskinesia. A 9-year-old states he was recently molested by his brother. What is the role of the PMHNP? A. Disregard what the child says. B. Notify the Child Protective Services and keep the child safe by separating the children. C. Assess because little kids usually lie. D. Notify the Child Protective Services and let children know you will see them in the morning. The answer is B. Notify the Child Protective Services and keep the child safe by separating the children. Native American is aggressive towards staff members because he wants his healing spiritual stick. What should PMHNP do? A. Educate staff. B. Remove the stick from room as it's dangerous. C. Give Haldol 1 mg. D. Continue restraints per unit policy. The answer is A. Educate staff. You ask a patient to count from 7 backwards during a MMSE exam. What are you assessing? A. Alertness. B. Serial of attention and calculation. C. Memory gaps. D. To test their math ability. The answer is B. Serial of attention and calculation. You notice a senior PMHNP asking you to conduct MMSE. She states, "So Maya, name 3 objects immediately." Where should NP document this as? A. Lifespan progress. B. Attention. C. Registration. D. Consciousness. The answer is C. Registration. PMHNP understand the best treatment for child with autism. A. Cognitive behavior therapy. B. Applied behavior analysis. C. Humanistic therapy. D. EMDR. The answer is B. Applied behavior analysis. PMHNP caring for a patient with PTSD. What is the best treatment for this patient? A. Cognitive behavior therapy. B. Applied behavior analysis. C. Humanistic therapy. D. EMDR. The answer is D. EMDR. Which of the following parts of the brain is responsible for executive function? A. Dorsolateral prefrontal cortex. B. Temporal lobe. C. Thalamus. D. Occipital lobe. The answer is A. Dorsolateral prefrontal cortex. PMHNP should not prescribe kava-kava if the client is on which of the following? A. Lithium. B. Bupropion. C. Benzodiazepines. D. SSRIs. The answer is C. Benzodiazepines. Patient has Beck score of 20. What will PMHNP do? A. Confirm MDD diagnosis and explore treatment. B. Do nothing. C. Inpatient admission. D. Send them home and reassess in 1 week. The answer is C. Inpatient admission. Truths about depression in adolescents compared to adults. A. Active suicide ideation is more predictable than passive suicide ideation. B. Adolescent symptoms are less similar to adults. C. Symptoms are similar. D. Rarely get depressed. The answer is B. Adolescent symptoms are less similar to adults. Reasons for different symptoms of depression or anxiety with children because of A. Neuroreceptors are still immature. B. Unknown etiology. C. Kids metabolize fast. D. None of the above. The answer is A. Neuroreceptors are still immature. Patient arrived in the clinic for medication management. Patient on Tegretol and presently smoking. How will PMHNP adjust the medication? A. Decrease Tegretol. B. Triple the dose of Tegretol. C. Stop Tegretol. D. Keep the current dose of Tegretol. The answer is C. Stop Tegretol. Patient has high TSH. What should PMHNP do? A. Keep the same dose of medication. B. Increase synthroid medications. C. Decrease synthroid medications. D. Recheck thyroid panel in 2 weeks. The answer is B. Increase synthroid medications. A 24-year-old feels isolated and feels like no one will like her, and she feels alone by herself. States that her life is miserable. What stage of Erickson is she exhibiting? A. Trust versus mistrust. B. Industry versus inferiority. C. Intimacy versus isolation. D. Ego integrity versus despair. The answer is C. Intimacy versus isolation. A 10-year-old states, I just cannot do this because I'm not as smart as my classmates. I just don't adequate. What stage of Erickson is he demonstrating? A. Autonomy versus shame and doubt. B. Industry versus inferiority. C. Initiation versus guilt. D. Identity versus role confusion. The answer is B. Industry versus inferiority. A 12-year-old failed to master his current stage. As a PMHNP, which Erickson stage is there a conflict of? A. Autonomy versus shame and doubt. B. Industry versus inferiority. C. Initiation versus guilt. D. Identity versus role confusion. The answer is B. Industry versus inferiority. A 20-year-old male is making new friends. As a PMHNP, which Erickson stage is he at? A. Autonomy versus shame and doubt. B. Industry versus inferiority. C. Initiation versus guilt. D. Identity versus role confusion. The answer is D. Identity versus role confusion. A 32-year-old male comes to the clinic, states he has been depressed and has suicidal ideation. Where do you document this assessment under MSE? A. Thought process. B. Orientation. C. Judgment. D. Thought content. The answer is D. Thought content. A patient is repeating the same words as PMHNP. Where should PMHNP document this? A. Thought content. B. Thought process. C. Memory. D. Perceptual. The answer is B. Thought process. A PMHNP asks the patient about plans to quit smoking. Patient replies, I thought about it. I bought cigarettes. Cigarettes are harmful. Cigarettes can kill humans. Where should PMHNP document this response? A. Thought content. B. Thought process. C. Thought insertion. D. Thought withdrawal. The answer is B. Thought process. A patient is wondering when PMHNP will switch from serotonin agent to MAOIs, because he is scared of serotonin syndrome. The PMHNP answer: we will wait. A. 3-day washout period. B. For half-lives washout period. C. 5 to 7 days washout period. D. No washout period is needed. The answer is C. 5 to 7 days washout period. A 40-year-old man with schizoaffective disorder has been hospitalized in an inpatient psychiatry unit for the third time in the last 5 years. During each episode, he becomes non-compliant in taking his medications, develops manic symptoms and auditory hallucinations, and then becomes violent. In the inpatient unit, he physically threatens other patients and staff and is generally agitated. He is put in isolation to help quiet him. The patient is prescribed a mood stabilizer. Which of the following medications might also help relieve this patient's acute agitation? A. Buspirone. B. Fluoxetine. C. Chloral hydrate. D. Risperidone. E. Benztropine. The answer is D. Risperidone.